Hey everyone, welcome back to Health Angel Solutions. Today we're going to talk about shrinking thyroid nodules, which is important because so many patients end up with thyroid nodules, which we'll talk about in a moment. The conventional approach to treating thyroid nodules is to wait and see, which we'll also talk about in more detail. If you have a thyroid nodule, you should try to treat it as best you can. I have some helpful tips that may be beneficial. Let's start by discussing some thyroid nodule basics. First, you should be aware that thyroid nodules are extremely common, as I previously mentioned. As you get older, the percentage of people with thyroid nodules increases, and by the time we look at autopsies of people who have passed away, we see a really high percentage of thyroid nodules in these people. So we know they're very common now. Fortunately, even though thyroid nodules are very common, 95% of the time they are completely benign, meaning they don't cause any problems. They just sort of sit there and do nothing. However, 5% of the time they may be cancerous, which is really the cause for concern here. Where you don't want to be sitting around with something inside of your body that could become cancerous. I should also mention that thyroid nodules that initially appear benign can eventually develop into cancer. So you should keep an eye on them and try to treat them if you have one. Furthermore, you should be aware that thyroid nodules usually do not result in any problems with thyroid function, which means that you already know that thyroid dysfunction can cause hypothyroidism and hyperthyroidism. What symptoms indicate the presence of a thyroid nodule? Usually, thyroid nodules are discovered through physical examinations or palpation. If you visit your doctor, they will examine your thyroid and may feel a bump, nodule, or notice something unusual. They will then perform an ultrasound to confirm the diagnosis and treat the condition. Therefore, thyroid nodules are basically just a risk factor because they can develop into cancer rather than impairing thyroid function. The problem with these self-examinations is that they aren't the most effective way to check for thyroid nodules. But they are simple to perform and I do recommend giving them a try. However, don't press too hard on your thyroid because you could cause problems. Your thyroid sits up at the base of your neck right about right here, so you can actually feel your thyroid gland and see if there's something bumpy in there or something that doesn't feel even with the rest of your tissues. This method has an issue because your thyroid is a three-dimensional structure. Therefore, if you can visualize for a moment, if the nodule is on the front, you can actually feel it because it's laying against your neck and you can kind of poke it. But if you throw it around, the nodules on the other side won't necessarily be able to feel it unless it's really big and then it pushes it outward. Physical exams are important because they're very simple to perform, but you might need additional testing to determine whether you have a nodule that's hidden on the back side of your thyroid gland. If that's the case, you can check it with a thyroid ultrasound. Furthermore, thyroid nodules are occasionally discovered through CT or MRI scans. But the most crucial test to determine the exact size of the nodule is ultrasound. This is because the radiologist who examines the thyroid nodule can see certain signs that indicate a higher risk of cancer. So if you are concerned, seek out ultrasound. This brings us to the standard advice for the majority of thyroid patients from the conventional side of things. If you were to visit your family doctor or endocrinologist, thyroid patients, or anyone who doesn't have a thyroid. However, people with thyroid nodules dislike the thought of having something inside of them that could become cancerous and doing nothing at all. For this reason, we're going to discuss 6 possible treatments. Before we get started, you should be aware that thyroid nodules are not always responsive to natural remedies or treatments in general. But even in that case, I think it's always worthwhile to try because the alternative is to do nothing. And why would you do nothing? As we discuss some of these treatments, you'll see that they're actually quite good. If you made it this far into the video, thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. Let me repeat those for you to see how they work. These treatments will, in fact, make you feel better overall, so there's really no excuse not to use them. To start, you should maintain a healthy and optimal TSH level. An excessively high TSH indicates that your thyroid gland is being stimulated at higher levels. TSH, or thyroid stimulating hormone, is a hormone that is primarily used to increase the synthesis of thyroid hormone. However, it can also be thought of as a growth hormone for cells that aren't functioning as they should. Keeping your TSH in the 0.5 to 1.0 range is the ideal range that you should be aiming for. And you can do that by either taking thyroid medications if necessary, because those will bring your TS down, or by using natural therapy supplements, diet, lifestyle, etc. that can also optimize and normalize your TSH number 2. You want to control your iodine intake because that will also increase the likelihood that a nodule will grow larger or turn cancerous. This brings us to our second topic, which is iodine. Both high and low iodine states have been linked, for the most part, to the development or production of thyroid nodules. Therefore, you want to find the Goldilocks zone, which is roughly 150 to 300 micrograms of iodine taken daily. However, you'll find that many people take doses that are either much higher than that, sometimes as high as 12.5 milligrams, or else completely avoid iodine, which is something you don't really want to do. Either way, you want to identify the Goldilocks zone, which is between 150 and 300 micrograms per day. This is the physiological range, meaning that your body needs to stay within it to generate thyroid hormone in a sufficient amount from all sources. Indeed, you might need to do some research to determine the source of all the iodine you consume each day. You might discover that some of it comes from supplements, beauty products, food, or even medications. However, make sure the amount of iodine you consume each day comes from no more than 150 to 300 micrograms. Thirdly, you should ensure that your immune system is functioning properly. This is because a dysregulated immune system has been linked to the autoimmune thyroid condition Hashimoto's thyroiditis. And we also know that inflammation within the thyroid gland raises the risk of developing thyroid nodules. Therefore, you can treat Hashimoto's thyroiditis and strengthen your immune system to prevent further damage to your thyroid and the subsequent formation of thyroid nodules. I should mention that you can order specific lab tests, such as thyroid peroxidase and thyroglobulin antibodies, to check for Hashimoto's and employ treatments to attempt and lower such antibodies if they are present. You should be aware that the majority of cases of hypothyroidism are caused by the autoimmune disease Hashimoto's thyroiditis, which does increase your risk of developing thyroid nodules. I should also mention thyroid cancer for the same reason number 4. There is a connection between blood sugar and insulin resistance and the development of thyroid nodules. I have videos that go into much more detail about this, including therapies, treatments, diets, and so on that can help you reduce your thyroid antibodies if they are present. Therefore, you should take action to lower both insulin resistance and high blood sugar if you have any of those conditions. Lessen your sensitivity to insulin if you have diabetes. Treating it will lower your risk and, if thyroid nodules are present, may actually help them decrease. There are several approaches to achieve this. I would advise concentrating on making a total lifestyle adjustment. You might need to cut back on your consumption of carbohydrates, take specific drugs, or take supplements. Insulin resistance and blood sugar levels can be effectively reduced by following the keto and carnivore diets. Therefore, that could be something to investigate further, but there are also many other ways to lower insulin resistance. You can also lower insulin resistance by eating more fruits and vegetables, so avoid the trap of experimenting to see what works best for you. 5. Make sure you are avoiding unnecessary radiation, particularly when undergoing tests like X-rays and especially at dental offices. If you are going to undergo imaging for any reason, make sure that you protect your thyroid gland with lead if it is of your head and neck. Finally, eat a lot of fruits and vegetables. The lead barrier will reduce the radiation that reaches your thyroid gland and ultimately protect it. There are many other reasons why you could be exposed to radiation, but they are usually too low to matter. Some of these reasons include sleeping next to someone who consumes certain foods, like bananas, or even traveling by plane. These exposures do expose you to some radiation, but usually not enough to cause those problems because the thyroid gland is extremely sensitive to even minute amounts of radiation. As I previously mentioned, there is a correlation between thyroid nodules and insulin resistance, which means that your diet can affect insulin resistance. Additionally, previous research has shown that individuals who consume a high fruit and vegetable diet are less likely to develop thyroid nodules. This may be because these individuals have lower levels of inflammation from their diet, which may also have an impact on blood sugar and insulin resistance. Consuming a balanced diet rich in fruits and vegetables has been demonstrated to be beneficial for a variety of reasons. In order to give yourself the best chance of shrinking your thyroid nodule, if one is present, make sure you are following these 6 treatments, or at the very least paying attention to them. Additionally, you may find that your thyroid nodule is a little more advanced. If you're concerned about the signs and symptoms that could indicate your thyroid nodule is cancerous, I'd recommend watching this video next. These 6 methods can be effective in managing thyroid nodules, but individual results may vary. Don't forget to like, share, and subscribe to Health Angel Solutions for more health tips and information. You'll be the first to learn about our newest videos and updates if you subscribe. I appreciate you seeing.